So Becky's not able to join us today. She's on another meeting. She did want me to bring up a couple issues. Just wanting to remind everybody that your monthly contract monitoring tool and your August invoices are due to us by Friday. So please make sure that those get to us by then. Appreciate all of your patience and cooperation and understanding with all of that. So please ensure those are done by Friday. If you're not able to get them in by Friday, we need for you to reach out to myself or Becky and let us know that those will be delayed. Let's see. I wanted to remind you all the GAIN office hours, GAIN/Civicor office hours that we have. Those are optional for you all to join. Don't feel as though you have to come to those calls if you don't have any questions or concerns about the GAIN or Civicor. We just wanted to continue to provide the opportunity for you all to come to us with questions, as this is a newer tool, or a new tool that we've implemented. Obviously, we're just trying to give you plenty of opportunity to ask us questions and get issues figured out as we move forward with this. Luckily, they're less and less attended, so we are hoping that's a good sign that everybody's kind of figuring things out, but we will continue to have those. They just won't be as often. So just kind of, again, just wanted you all to know that those are optional for you to attend. Alrighty, with that being said, I think we're going to go ahead and just jump into our first presentation, or our only presentation actually for today. I would like to introduce Violet with Rocky Mountain Health Partners. Her team is on as well. So I'm going to go ahead and pass it to you, Violet, and welcome to our group here.
Thank you, Kelly, and thanks everyone for having us today. So like Kelly said, I'm Violet Willett, and I'm the Director of Care Management here at Rocky Mountain Health Plans. And I also have some staff members. I can't see everybody, but Audrey, I believe I saw you on. Would you please introduce yourself?
Hi, everyone. Good afternoon. Audrey Oldray. I'm the Manager of Care Coordination with Ray 1, Rocky Mountain Health Plans.
Thank you. And Molly?
Hi, good afternoon, team. Molly Tonello with Rocky Mountain Health Plans.
Thank you. And Audrey and Molly, please feel free to jump in and just add any information that you think would be helpful to this group. And so I will start sharing my screen. And when I am in this mode, I can't see if somebody's trying to get my attention or if something is in the chat. So please feel free to interrupt me. We want this to be as interactive as possible. So I am going to try to share again here. And please, if someone could just let me know if you're able to see my presentation now.
We sure are. Thank you.
Okay, great. So like I said, I'm here with Rocky Mountain Health Plans, but these services are really available throughout the state of Colorado. So if you are working outside of our region, these services are still available, and I try to include information on that as well so that you can access that information if you should need it. And then you can always reach out to us and we can try to help you access that as well. So, kind of going to do an overview of Rocky Mountain Health Plans, but going to try to inform people how they can access these services that might really be helpful to our shared, what we call members. Sometimes it is really hard to, okay, there we go. Okay, so just really quickly, high-level overview of who is Rocky Mountain Health Plans. We've been around on the Western Slope. We were founded in Grand Junction. We've been around for 50 years. We just had our 50th birthday, and we are a subsidiary of United Healthcare. And we have a lot of different work that we do that I'm going to share with you, but we're really focused on providing whole person health, which includes physical, behavioral, and social well-being. And we are also the backbone organization, kind of working behind the scenes, where we provide a lot of funding and resources to a lot of different providers, counties, and other community partner agencies. And that's the same is true for other RAYs. So I thought it might be helpful, and I don't know how much everyone here knows, so just trying to do a high-level overview of how the healthcare for Colorado is structured. So the state of Colorado is the bigger sort of overarching umbrella, and underneath that we have healthcare policy and financing, or what we call HCPF, and through HCPF is the regional accountable entities, and I'm going to go more into that, of which Rocky is Ray 1, and then the Behavioral Health Administration, and I know there are several folks here, but for the Behavioral Health Administration, they have the Administrative Services Organization, or the ASO, and the Managed Services Organization, the MSO. And I'll try to not use a lot of acronyms or abbreviations, just because I know that can be hard to follow, but just so that you can kind of understand how it's structured. And it's really important to note that Rocky has a lot of these programs, but again, these programs are available throughout the state, but they may not all look the same as far as the structure is concerned. So at Rocky, we have a big umbrella where we do a lot of different work, and I just wanted to just share just a visual representation of what we do, not for anyone to try to commit this to memory, but just so that you understand sometimes when you're working with Rocky, we have a lot of different activities that we do and programs and a lot of different departments. So sometimes maybe something that you need might be in one department or, or another, and you don't need to memorize all this again. You can just reach out to any one of us. We all work very closely with one another, and then we can triage or route you to the right place. So please keep that in mind. So we are the RAY for Region 1, which is the Western Slope in Larimer County. We are the Administrative Services Organization, which provides crisis services, and then we have programs for children, youth, and families under our ASO. And we are the Managed Services Organization for the Western Slope, and then I'll show you a map of what this other thing means. And then we're the Case Management Agency for 19 counties in the state as well. And the Case Management Agency really provides more robust and intensive care coordination services for people that meet certain functional criteria for supplemental, what I like to think of as supplemental Medicaid programs. And we can get you connected to all of those as well, which I'll cover again in a few minutes. So as the RAY, we have a lot of different things that we do, and all of the RAYs kind of are responsible for these same bullets. We have a network of primary medical homes or primary care practices. We have a statewide network of behavioral health providers. We administer healthcare policy and financing's behavioral health benefit, or we drive Medicaid for the state of Colorado. And we really are focused and committed to the overall health and well-being of our population. And part of how we do that is through coordinating care among all of the different sort of disparate providers and entities that exist throughout our state. And so part of what we're going to talk about in a few minutes is the care coordination team that we have at Rocky. So every Medicaid member in the state of Colorado has free care coordination services available to them. And then also care coordination is available through those other programs that I mentioned as well. And, the care coordinators can really help sort of be that person that is the connector of all of the different resources, the different agencies, and so forth. And so Molly and Audrey, who are here today that you just met, they really work very closely with all of the different community partners and entities to really try to connect the member to all of those different resources and to kind of keep track of all the different agencies and different entities and resources that a person might be, kind of tied to or working with. So a little bit more on that in a second. So here is the current map of Colorado. So currently the state is divided into 7 different distinct RAY regions. And so as you can see here in green, that is Rocky's territory. So that is the area that we cover under RAY 1. And then I don't know if it's too small to see, but I'll share this presentation with Kelly and she can disseminate it. But also you can see here the names of the other current RAYs in the different regions. So if you're working in a different part of the state outside of our territory, again, you have access to a lot of these same services through these other RAYs. And I have a link coming up here in a second where you can find out how to get in touch with them as well. So starting in July of 2025, the state works on a fiscal year. So the next fiscal year is in July. This is going to be the future RAY map. So I just thought I'd include it in case there are some changes to some of the borders or some of the regions where you may work. So just so that you're aware that this is what it will look like in the future state. So we just recently kind of found out about this information. So there will be some changes, but again, I would imagine that all of the benefits will stay the same or be more enhanced. I don't think it will affect what is available to people. So again, just wanted to provide that for just your knowledge. So Like I said earlier, we have care coordinators that work with what we call our members, and we have quite a variety of different types of subject matter experts and people with different backgrounds and experience. So we have RNs, so we have nurses that work with members with our most complex physical health needs. We have social workers that really are the subject matter experts on the different community resources and, just kind of that dynamic of, how families and communities and so forth are structured. Behavioral health care coordinators, which really have kind of some of the most challenging situations where they work really closely with people that have significant mental health or behavioral health concerns, and they work very diligently with some of the most acute members in our population. And then we have just general outreach care coordinators that do a lot of sort of outreach where we target, some of the outreach that we do to try to engage our membership. And all of our care coordinators have access to the language line. So if somebody is not a native English speaker or English, they're not comfortable speaking in English, all of our care coordinators have access to that language line, which covers, I think, almost every language that's spoken on the planet. So that should not be a barrier. And then we provide a lot of different education and other things to our population. I'm going to cover a little bit more about what we can do. So, again, I'm trying not to be too far in the weeds, but I thought it's important to know because we have sort of a hybrid care coordination structure. And so I think that can sometimes be confusing to people in our region. And again, I don't know about how the other RAIs are doing it, but probably something similar. So we have our own internal Rocky care coordinators, of which Audrey and Molly are, part of that group, and they lead that group as well. We also partner with existing care coordination teams throughout our state, or our region rather, that are connected sometimes with different providers or with counties or with other entities. They're really the subject matter experts of those local communities and really understand the specific needs of that community as well as the different resources and sometimes lack of resources in those communities. So we partner with those agencies, and sometimes that can create confusion because maybe you're working with an agency, but they're not what I call branding themselves as Rocky, but they are part of our care coordination network. And then we partner with different community agencies to do different work and collaborate. Like I said earlier, we are sort of the backbone of a lot of different work that's going on in the community, and all the community mental health centers, various providers, various community entities are all sort of working collaboratively with our RAI, and again, probably very similarly with the other RAIs. So there is a lot of work where, care coordinators can provide assistance and help to some of our mutual clientele, or as we call them, members. But I wanted to share these bullets because I feel like these are some of the ways, like if you're thinking about what somebody might need and when should I reach out to Rocky, how can this benefit our population that we work with. And it's not limited to these, but these are just some of the ways you can think about when you can reach out to us. So Medicaid members have non-emergent medical transportation benefits available to them. So appointments to physical health or behavioral health appointments to and from, and we can help people coordinate that, schedule that for them, or provide them those resources. Connecting people to various behavioral health resources and providers, we could help schedule appointments, we can help find providers and really get people connected to those resources, or if you need a list of resources, we really try to collaborate very closely with different community partners. Other providers, sometimes people might forget about dental or vision. Those are also benefits that people have under their Medicaid program, and we can help find those providers as well. Locate a primary care provider. A lot of times people who have different social needs or other needs are not thinking about having a sort of a primary medical home, and sometimes they're really just going to like the ED or to the hospital and not really doing a lot of preventative care. So we really work closely with members to try to find them a primary care physician, try to see what barriers might be preventing them from going, try to remove those barriers, and schedule appointments or whatever else they need. And referrals to community resources. So I think this is a big one that we can really help with, that sometimes people aren't thinking about us because you might not be thinking about that with their Medicaid benefit. So we are committed to, as I mentioned, whole person health. And we know that a lot of people's needs are around their social needs, especially with the Medicaid population. And so we have relationships with all of the various community food banks in our area. We can help people get enrolled in different benefits, SNAP benefits, other programs like that, where they can, access those resources. So again, we're not limited to these activities, but we can really try to connect people to different resources that are available out there. And then also substance use disorder and medication-assisted treatment options and providers. We have a network, like I mentioned, of behavioral health providers, and a lot of them do SUD and MAT treatment. So if you're working with an individual that needs that, we have a lot of different providers that will kind of, depending on the need, will triage and sometimes prioritize people that have significant needs and try to get them in quickly. And then our care coordinators can follow up with people, assess them for needs, develop care plans, and then just sort of maintain that relationship of reaching out to people to see if they are going to different providers. Are they following through? Are they following up with the different goals that they might have toward their health or their social needs? So sometimes, I don't know what your structure is as far as how you work with people, but sometimes, you may not know if people are following up or following through with some of these activities, and we can be, again, that group that does that with individuals. So making a referral. So the bottom bullet here is how to make a referral to Rocky. So this is our direct email group that is monitored. We have a designated care coordinator that monitors that during business hours, 8 to 5, Monday through Friday. And it's also monitored by our leadership team, including all of the people that are here on this call. And so when we get a referral, we triage it, we route it to the appropriate team, and then we let you know that we've received the referral and that the member or whomever you tell us to call should be expecting us to outreach. And usually we outreach within 24 hours, but no more than 48 business hours to outreach people. So sometimes you might wonder what happens after you make that referral and we say, hey, we got the referral, someone's going to call. Just know that our typical process is we make 2 phone call attempts. And then if people don't answer, then we'll send them a letter saying, hey, we were trying to get in touch with you. Here's how you can reach us, and here's what we can do to help you. And then, as I mentioned earlier, some of you may not be in Region 1, so I've included this link here, which is a really good link, I think, to have in general. Just maybe save it to your favorites, where it has sort of a Q&A and also a way to make referrals to other RAIs throughout the state. So if you're in another part of the state and you don't know how to make a referral to that organization, you can use that link there. And like I said, I mean, it's a good resource to have in general, just to keep handy.
Violet, may I ask one question real quick, this Kelly?
Of course.
So are people able to make referrals to this email address on behalf of somebody who is still incarcerated?
Yes, totally. So anyone can make a referral. First of all, I forgot to mention that. A person can self-refer, a family member can refer, community entities can refer. And Molly or Audrey, you might need to help me here with how the benefit changes when someone's incarcerated. I know they have a different type of Medicaid benefit during that time, but that doesn't limit us from trying to do that discharge planning, as we call it. You may have a different word or name for it, but absolutely we can start that process so that people are successful when they reintegrate into the community. So Audrey or Molly, did you have anything to add to how that works with how the benefit changes?
I can jump in on that. So what we would basically do is we could work with them to get providers set up for when they do release. We do that currently with Department of Corrections for people releasing out on parole, and whether that's us meeting with them right when they release or meeting with them ahead of time and figuring out what their needs are, doing a screening assessment, and then Like I said, if they had providers that they previously saw, then we would contact those providers and get them in, or we could get them connected with new providers.
And it looks like Molly just put in the chat the email address for the referrals, which thank you so much for doing that. I would highly encourage everybody to follow up and work with these folks when you're looking for additional resources. So I just wanted to make sure I was correct in my understanding about when people can make a referral and whatnot. We've got 41 people on the call, so we've got a decent amount of jails represented here today. So this is really great. Thank you for answering my question.
Yeah, and Kelly, thank you for kind of making me pause, because there are some additional things I wanted to share. We also can work with you if you have, certain, I don't know if you have like regularly scheduled meetings where you're talking about people that are going to be released or discharged or whatever the nomenclature is. We can work with you and attend those meetings. We can brainstorm. We can attend case conferences or whatever would be helpful to really, again, just come to the table and work collaboratively with our community to make sure that people are set up for success when they do reintegrate into the community. So, it doesn't necessarily just have to be a referral. There are other ways you can utilize our resources, which is, again, why I wanted to provide sort of a high-level overview of all of the different things that might be beneficial to your organizations, so that when you're thinking about people kind of going back out into the community, how we might be able to provide that safety net for these individuals. And now I also do want to add, as far as the referrals when people are incarcerated, for that part, I can only speak on behalf of Rocky. I don't know exactly how the other RAIs do that, but I would recommend reaching out to them. It's worth a shot to see what their processes are if you're working somewhere else in the state outside of the Rocky region. So I just wanted to add that. But for us, we absolutely want to be as proactive as possible. And again, to begin that discharge planning process while people are still incarcerated or even inpatient or whatever the case may be.
Awesome.
Great, so that was kind of a high-level overview of the RAI and the care coordination. And again, really just reach out to that email group or to any of us here on this call if you have an idea or you're just wondering if there's something we can do. Absolutely. And so the Behavioral Health Administration programs under Rocky, I am not over those programs. Maureen Carney is, and I've provided her contact information on a subsequent slide here. But I can just sort of give people an overview so that, again, you have just some level of understanding of these resources being available through Rocky, as well for some of the other issues that you might encounter. So as I mentioned earlier, in the structure of how the state does healthcare in Colorado, so the Administrative Services Organization and Managed Services Organization sometimes are not under the same umbrella as the RAI, but for Rocky they happen to be. So we happen to manage all of these different services here. So the Administrative Services Organization has a couple of different things that they do, and I'm again just really going to give a very basic overview here. And if you want more information, Maureen, I'm sure would be happy to come. But we contract with and provide oversight for providers who deliver behavioral health crisis services throughout Region 1, and then children, youth, family behavioral health services. So just if you're wondering about what kind of resources are out there for folks, a lot of that would be under the Administrative Services Organization, or ASO. So we do have robust crisis network and different crisis providers throughout our region. So again, if you're hearing like Rocky was involved, it might be through one of these programs. So this is the map of the Administrative Services Organization, and you may notice it's not exactly like the RAI map, but there's a lot of work being done to align that for the future state that I mentioned. So Rocky is the Administrative Services Organization for the section here in green, which fortunately for us does align with our RAI region. So it's the same counties for us that are covered under our ASO programs. So some of the different crisis services we have are mobile crisis response services. So that's face-to-face behavioral health interventions throughout the community for people who need screening, assessment, stabilization, and connection to community resources. In a couple of areas, we have a walk-in center, crisis walk-in center. We have a crisis stabilization unit in Montrose and Fort Collins, and then respite services available in Durango. And again, the other ASOs throughout the state also probably have some similar functions, but I can't speak to exactly what they have. And then also something that might be beneficial is the crisis resolution team. Now, a lot of the programs under the ASO are focused on children, youth, and families, but crisis resolution team is really for people up to the age of 25. And so I know sometimes you might be working with young people, and so the crisis resolution team was a pilot, but I think they decided to expand the program, if I'm not mistaken. Again, Maureen would know better, but for us, the counties that are covered for crisis resolution are Montrose, Delta, Mesa, Archuleta, Montezuma, and La Plata. And so people have to meet certain criteria, such as, they've used mobile crisis services or they've gone to the ED, and it really provides a lot of support for youth and young adults for having various mental health crises. And it's really to try to prevent unnecessary hospitalization or other out-of-home placement. And it's really intensive, short-term support that is provided in these ways, such as are here on the site: in-home therapy, peer support, care coordination, and case management. And again, that's specific to Rocky, but CRT is available in other parts of the state. So again, if you work in other parts of the state, here are some of the different counties where CRT is currently available. And again, I think they're planning on expanding it more, and maybe it'll be available throughout the state at some point. I'm not really sure what the plans are for that, but it is a service that's available sometimes when you're working with young people that are experiencing kind of ongoing crises, or maybe people that you see kind of often. And then the managed services organization, again, really helpful for you to just kind of have in the back of your mind that, the managed services organization is available to people whether they have Medicaid or they don't. So it doesn't matter whether they do or not. And it really does provide substance use disorder treatment and support, such as these bullets here: withdrawal management, detox, residential treatment, medication-assisted treatment, outpatient treatment, and others. And so, like I said, this is for people. You may be working with people who might not have Medicaid. I don't know who your population is that you serve, but sometimes you may not be aware of the fact that managed services organizations can provide those services to those individuals through the MSO benefit. And again, even if it's not with Rocky, it is available through other MSOs throughout the state. And there are other ways that it supports us, even for Medicaid members. Like sometimes people need to go to like sober living or other types of places that might not be covered under Medicaid. And so through the MSO, there was like supplemental or additional funding. But most of the MSO work is through the MSOs fund a lot of different providers to provide substance use disorder treatment. So some of it is done sort of like in that behind the scenes way. But again, if you're working with people and they need some of these services and maybe they don't have Medicaid and you don't know what to do, or if they're undocumented, I think, and Audrey and Molly, correct me if I'm misspeaking here, but I think it also applies to people who are undocumented. So that might be another resource that you weren't aware of. And again, it's available throughout the state of Colorado, but for Rocky, this is the map here. So Rocky, again, very fortunately, very similar to our other Ray map. You can see we are the managed services organization for all of the counties in our current Ray and ASO programs, except not Larimer County. So in Larimer County, it's different, but we cover those counties on the Western Slope in gray and bright blue. And so I've put here on this slide the other managed services organizations that are available through the state. And when you're thinking about, different populations that might benefit from MSO, like IV drug users, pregnant members, and people, pregnant members who are IV drug users, those are priority populations, and people on an involuntary commitment. And then we have jail-based programs in Routt and Grand counties, the community-based circle program, residential treatment for individuals with co-occurring disorders through Mind Springs. We do have a care coordinator that is not on my team, but she's specific to this work, and we can certainly connect you to her if you had somebody that is in the Rocky region that had needs for these services. And then they have like recovery living scholarships that are available through certain homes in Grand Junction. And again, we provide a lot of funding, so we fund recovery support organizations that really help people during various different stages of recovery, and especially for those things that might not be covered under Medicaid, which might impact some of your populations. So when you're thinking of someone who might be releasing from jail but might need to be in a sober living environment or that kind of thing, you should really contact your local MSO and see what they have available and how that process would work. And so here I have provided just some contact information. If, because I did share a lot of information here, and if you can't remember exactly what I said or whatnot, feel free to email me or email that referral group that Molly put in the chat, or it's also on this slide. And then if you wanted more information on the ASO and MSO programs that we have available, Maureen would be more than happy to provide that information to you. She has some one-pagers and some other information that she'd share, or she can come present, or anything else that you might need. And if there are other ways that you think of that we might be helpful to provide support or information, maybe you have a team or whatnot, we're always happy to come join. I know Audrey and Molly are very passionate about serving this population and really working with you folks, and would, again, be very happy to collaborate however is beneficial. And so Audrey and Molly, anything I forgot before we turn it over to people for questions?
I don't have anything. Molly, do you?
Nothing specific. Looking forward to kind of just the free dialogue. Danielle, I did ask a question in the chat. Excuse me, I said Danielle, I meant Danielle. Pardon me. Regarding CRN, and yes, we've been in that tool and utilized QHN. I think for a couple of years now. So welcome referrals to come that way through if that's easier for you guys. Pardon me
and
for
I'm glad
getting
you
your
brought
name
that up.
wrong again.
I usually include that on my slides, but then I wasn't sure about the audience, so I thought, well, I'm giving them so many acronyms already. But that's a good call out. We are in CRN, so please feel free to make referrals to us that way.
Fantastic. And yeah, we encourage you to reach out to your RAIs, especially there's going to be a lot of more opportunity, we think, for this collaboration once the Medicare waiver is passed. So I think there's going to be, I know there's going to be a ton of room for collaboration here. And luckily, just so you all know, some of our jails do already have what we would dub as a reentry coordinator or transition planner. Some of the JBBS jails do have positions that are specifically geared to that type of work. So we've been lucky that we've been able to make reentry more of a priority over the years. And especially, that's the purpose of this jail-based behavioral health services program, ultimately, is to kind of reduce the recidivism. And so using as many tools in the community as possible will help us accomplish that goal. So everybody who is here today, again, I would really highly encourage you to reach out, get these conversations going with your RAIs, so that kind of some processes can start getting put in place, and we can get the right people get people to the right resources, I should say. So did anyone else have any questions or comments? I haven't seen any in the chat, so I wanted to throw it out there one more time. Well, ladies, thank you all so much for hopping on today and joining us and giving us this information. This is going to be helpful for all of our jails. So once we get this meeting recording uploaded to the website, which should be hopefully today or tomorrow, you'll have access to all this information. And yeah, just thank you all for joining us today. We appreciate it.
Thank you so much, Kelly, for having us. Thank you, everyone. Bye-bye.
Absolutely.
Bye. Thank you. Thanks, Kelly.
You bet. Thank
Bye.
you all so much for joining us. We appreciate it, and we'll be talking to you again real soon.